We always talk about vision. It's not actually the vision which is important, it is the life also should change.
Would you let us know how the perception of specs have changed over the years?
Talked about kids, they need to have a proper correction.
Okay.
The concept of not wearing glasses is not good. Glasses are meant to improve your vision. Lot of premature babies are surviving. These premature babies bound to have a disease or a deformities in the body, and this includes eye also. In eye you can have the growth can be hampered. That is damaged, the child can be blind. People have the access to various social media, but unfortunately this information may not be 100% correct sometimes. Sometimes the social media may mislead people also.
What are the major eye problems that people face?
Let's start from the winter now. Once you have a winter, the entire polluted particles, they become like a smog and they come down and they hit your eyes, and these can cause
Hello everyone. Today we have the honor of hosting Dr. Jeewan Singh Titiyal, a Padma Shri awardee and a pioneer in refractive surgeries, cornea transplantation, and advanced cataract procedures. As the head of clinical services at Dr. Agarwals Eye Hospital, New Delhi, and former chief of Dr. R.P. Center of Ophthalmic Sciences at AIIMS, New Delhi, he has revolutionized eye care for over 4 decades now, innovating in keratoplasty, intraocular lenses, and robotic cataract surgery. His groundbreaking work in keratoplasty and limbal stem cell transplantation has restored vision for thousands. Needless to say, Dr. Titiyal has shaped the future of eye care, winning accolades like the Best of Show Award at the American Academy of Ophthalmology. Today, we'll explore his journey, innovations, and vision for the future. Dr. Titiyal, welcome to the podcast. Dr. Titiyal, your journey in ophthalmology spans decades. What made you pursue this field?
Thank you so much for this broadcast invitation. Journey is always, you have to look back what you have done in the past. And if I see my own journey in this medical field, I think it has been a remarkable period for me, very satisfactory, because I feel I was fortunate to be in an institution like All India Institute of Medical Sciences, where I did my undergraduation, MBBS. Then I could get into a post-graduation in the field of ophthalmology. I could, get into a mind and vision of people who are suffering. And that put me into a thinking that I should be doing some surgeries which can really change the, quality of life. We always talk about vision. It's not actually the vision which is important, it is the life also should change. And doing keratoplasty in those patients who are actually blind because of corneal opacities, where you can do a transplantation or grafting of a tissue which has been donated by the people after somebody's death. And that was thinking something which is out of the box. And that really excited me in those younger days. Do activities which will not only benefit them, their families, their future, and also contribute to the country also for a development. The best part in treating people with the ophthalmic disorders, like there's an immediate reward. Today I do a cataract surgery on somebody. Tomorrow he is so happy that he's seeing so well, he'll thank you immediately, which is very rare in other medical fields. And same thing holds true for a younger people, like you are there, people who are wearing spectacles. They are, actually sometimes can be really psychologically disturbing also for them. And doing a refractive correction, we have this laser correction for these people, and that not only shapes their cornea for a better focus, that shapes their vision also. And they are also, next day they'll come, doctor, you have done a great job for me, you have changed my life. In fact, I remember one episode, in my busy OPD, I saw one young girl rushing towards me and she was telling me, I want a selfie with you. Today is my birthday and because of your surgery, I am without glasses today. So that type of advantage you have in this particular field, I think that is the journey ahead, remarkable.
An unparalleled journey, and after so many years in this field, how does it feel to begin as a beginner again?
I think one term I can coin here, because as people know, I have just superannuated from AIMS New Delhi as the chief of the center, highest position you can acquire in this particular area. Now I'm beginning a new journey, that is working in a private sector. I was telling my friends that I am the most experienced beginner in this field. The entire journey I had in a government setup, where a patient come with a different attitude, different approach. We also approach in a different manner. But once you are in a private setup, your thinking has to be little different, because I'm not going to have a same patient crowd with me, where if I'm sitting there, 100 patient crowding on me. In private sector, it will be different. The appreciation of those people are also different, because they come with a different mindset. So I'm very happy that I've joined an institution or chains of hospital, which are Dr. Agarwals Eye Hospital. They provide this facility where patients come with the thinking they'll get the best infrastructure, best equipment, and best services. Apart from that, best experts to provide these. I'm pretty sure I'll be doing a good job in this area also. And I feel my second journey will be as remarkable as the journey I had before also.
Indeed, sir. We have no doubt about that. Is there anything that you're especially looking forward to?
In certain areas, because country which is growing very fast, the life expectancy of our people have also increased. I'm looking for those people who are in older age. They are not going to grow younger. They require support by improving their vision, which they may be suffering because of cataract, because of glaucoma, because of retinal pathologies, because degeneration is one cause for aging. Aging causes degeneration. And same thing happens to the patient's eye also. So this degenerative disorder requires prevention, cure, and the rehabilitation also. The second area which I'm looking for is the other areas of work profile wise. We have a lot of working group. They also have a lot of other issues with the eyes that can also be modified. We can form the guidelines, treatment. I'm working on that, feeling that we can do something better for this group also. And the largest chunk of people are school-going children, younger age group. They have a different profile of, you can say, difficulties. People getting myopic now, use glasses quite often, and that requires the proper correction, proper checkup, so that we don't hamper their educations and their psychological growth also. The last area which I'm going to work in future, which is really, it goes with the advancement in technology. A lot of premature babies are, surviving. These premature babies bound to have a disease or a deformities in the body, and this includes eye also. In eye, you can have the growth can be hampered. You can have a retina can totally be damaged. That is the part of eye which actually takes the this visual sense to the brain, and that if that is damaged, the child can be blind. And it is just sort of a semi-emergency. Once you have these babies, you have to treat them fast. So we require an infrastructure to be developed. Working with Dr. Agarwal's group, I think this is one area I'm going to work to reach the peripheral areas, to improve the primary healthcare area also, if possible in next 5 to 10 years, like to develop multiple such hospitals across North India, so that we can reach up to the masses, which is I think, apart from being the central part of India in New Delhi, it will be our responsibility to reach the periphery also.
Very excited to have you on board. So how does a cultural and societal setup has changed eye care over the decades?
Any medical facility, any medical treatment changes with time, not only because of a cultural change, the cultural or social values have also changed in the society. The approach to disease and treatment have also changed. So as far as cultural values are concerned, people have the access to various social media. You can have internet services which can give you a lot of information on what would be this disease, what are the various signs, symptoms which can be there, what are the treatment values for these, which are those areas you can get treatment, which are those doctors which can facilitate this treatment. Those are available. But unfortunately, this information may not be 100% correct sometimes, because sometimes these social media may mislead people also. Again, you have to reach the institution, doctors to get a right opinion. I would say there has been change in the social culture value, information wise, but to get into right place, right people, you still have to get into, I know, people who are servicing these areas. They'll give the right opinion. We all understand, if you look at medicine wise, we always say prevention is better than cure. For prevention, we have to work in a lot of areas. That is educating the society, improving their lifestyle, and improving our other infrastructures. If I see education, the entire education system should change in a way so that we put less stress to our young kids, because it is the stress of our education which is causing these problems. Not only the physical disorders, like your vision may get distorted, you may get physically you can say weaker, but it is the psychological problem which is faced by the new generation, which has to be looked into. So if you improve the vision, improve the health, then psychology will also improve.
We always talk about a lot of changes that have happened in the decades, but is there some value, or rather some aspect, that you want to restore from the old times, that you want to stay intact coming forward to?
Things which has been a past, it's very difficult to regain them. But there are certain things which have a value of for improving your lifestyle. I would say, if I can improve my physical activities, like people can go out and play, because now today your friend is your mobile phone.
What are the key precautions that people can take in their daily routine to maintain good eye care?
That's a very good question that relates to all of us. So first, I'll go with the working group. So they are working almost now. If you like into generation now, they'll be working not less than 8 to 10 hours a day, and they are sitting in PCs or laptops, or working in a closed room conditions, which is totally air conditioned. So that also puts a lot of stress onto your ocular surface. Ocular surface means the exposed part of the eye, and it is normally covered by the tear film, which moistens the ocular surface, also improves your vision, also improves the health also. So dryness can be caused. So dryness should be a disease which should be avoided. If you have a dry eye, make sure you treat that also. So I would say people who are in the office areas, if they keep blinking knowingly, so we have during COVID time we have made a rule which is called 20-20-20 rule.
Yes.
So if you have stress of a work for at least 20 minutes in your computer, to break for 20 seconds, look towards the outer side where you can see infinity. Or if you see a green thing, that will be better. Or blink at least 20 times. That will break the cycle of dryness.
How much of a role does genetic plays when it comes to overall eye health?
Genetics are one of the most important part of any species. So we are there because our genetics are there. Yeah. But unfortunately, genetics can also get modified. There can be mutations. There can be inherited deficiency in genes, and that can cause various disorders. And that holds true for eyes also, as you were asking. In eyes, we have various disorders which are affected by genetics, like as I talked about retina. You can have a retinal disorders by genetics. You have the optic nerve, which takes the image to the brain. That can also be affected by genetic disorders. Or the anterior parts also, they can also be affected. So there are numerous types of genetic disorder affecting eyes also.
Is there a way of finding those defects before birth in kids?
Yes. There are various ways you can detect how the baby is growing in the mother's womb. Yeah. That can also be picked up. Various tests are there. especially if you have a history of having something in the first 3 months of your perceiving. That is, you had a high fever, you had some viral issues, or you're exposed to a radiation, like unfortunately you have to undergo MRI at that time. Nowadays, we can take out the fluid from the inside the baby's area. That fluid can be analyzed. That reflects what type of deformity may be there. But there has been a recent innovations also where we can treat the baby before the birth also, inside the womb also.
Considering Delhi's weather, what are the major eye problems that people face? And especially during monsoons also, there's problems like conjunctivitis. That's very, very common.
Delhi has, winter, summer, autumn,
We're very
spring.
lucky like that.
You're lucky.
Yeah.
But each season puts you into some sort of stress now. Let's start from the winter now. Once you have a winter, the entire polluted particles, they become like a smoke and they come down and they hit your eyes. And these can cause a lot of irritation to your eyes. Your eyes can become red. And I've seen people coming with the watering and massaging their eyes, and wearing contact lenses will be difficult, working will be difficult. So that is a major problem for everybody who are coming out of their house also. Even you are inside also, it is going to hit because the pollution levels go very, very high, which is sometimes goes poor to very poor to unlivable also. As I said, washing your face, using some sort of drops. Like we normally advise lubricant drops or artificial tears that can take care of your surface and remove the those pollutants from eye also. That should be used, especially those people who use contact lenses. They should
How
use.
often should we use these lubricants?
It depends. Normally 2 to 3 times is a good thing. But if you still have an irritation, some sort of foreign body sensation, use it. So it is a very healthy way to, rather than putting something which you don't know.
Doctor, we spoke about kids getting their checkup. So how can we involve admin into this so that when the kid is going to school, there's a proper establishment that you're getting checked up for this?
I fully understand, Shruti. You're talking about myopia in kids, which is a major thing nowadays. Not only India, world across, and the prevalence is increasing every year in these young kids when they are going to school.
Yeah,
and there are various factors which can cause myopia in school-going children. It's all because the culture has been similar. They are all hooked up with the mobile phones, with the electronic media, and unfortunately we had a COVID in between.
yes.
And COVID has also increased myopia incidence not only in our country, entire world, because you had to work from home. The classes were happening at home. You had to be sitting in your laptop for 2 hours.
Too much screen dependency.
And that caused, because closer work with lot of stress on eyes causes myopia. Second factor for myopia was the school work. Lot of work shifted to electronic media only. The classrooms have electronic media only.
Those
now.
whiteboards.
Everything. And there is no physical activity in the schools. If they have a vision defective, then they should have a corrective glasses. That will prevent further progression. Because many parents have some sort of they feel psychologically my kid will be under pressure when they use glasses. They say, doctor, can we avoid glasses? Unfortunately, that's a reverse thinking. If you give a glasses, the child will see better. Maybe physically, maybe little defective. But in fact, that improves your vision, and the classroom activities, the education, you can say, standard might improve for that child also. And same holds true for our Dr. Agarwals Eye Hospitals also. We have a focus on a myopia also. So we have myopia clinics.
Would you let us know how the perception of specs have changed over the years?
The concept of not wearing glasses is not good. People say once you use glasses, your vision will get permanently poor.
We keep hearing that.
So that's not a good way to look into. I think you should understand, the people listening to us, glasses are meant to improve your vision. And once you have a better vision, you perform better also. Today, one of the major challenge for us is to block the blue light. Because this wavelength is detrimental to retinal tissues. Longer the exposure, like 10 years, 20 years, 30 years, you might have a degeneration coming up with this blue light hitting you. And nowadays we have all the street lights, and most of the lights are LED lights, and they are harmful to eyes also. So blue light filter lenses will be better.
Can we talk about refractive surgeries also? Over the decades, it's been advancing. So, what are your thoughts on those?
It's been one of the most successful surgery in the human body in terms of predictability. So I say I want to correct -1, it will correct -1. Currently, we have 2-3 ways to correct these laser surgeries. One, you would have heard LASIK, which is one of the commonest surgery done across the world, where we raise a flap from the cornea. It's treating only cornea, the black part. We lift a flap, then we ablate the cornea by laser. With laser treatment, we are reshaping this lens to take care of error and put back the flap. So from next day, you see quite well. Other surgeries, we don't make the flap now. We just make a pocket and take out the amount of tissue which can correct or which can reshape the cornea. Take that.
So basically less invasive.
Less invasive and more stable, because there's a small incision, hardly 2 millimeter incision. We take out this lenticule, and this is fashioned by the laser. That is called femtosecond laser, and very accurate, and hardly any complication now. That's because the surgery has improved, and as I said in the beginning, the screening has improved. We have various devices which can rule out the corneas, which can subsequently have a complication. So refractive surgery has been one of the most beautiful surgery for people.
The question that now that you're moving from AIIMS to Dr. Agarwals Eye Hospital, how are you going to do justice to your patients, to your practice? Because not everything is going to be same. So any word on that?
And that's a very pertinent question at this stage. The people have in mind, AIIMS has everything, and other institution may not have those things. So how can you provide that type of treatment to your patients? But I'm very happy to say that I've joined Dr. Agarwals Eye Hospital group. In fact, I can put my cards there, and they're going to respond to that. And I say that this particular hospital, which is going to come in New Delhi, should have equipments, instruments, and the areas which is as good as AIIMS or better than that. So I'm looking for that. In fact, we are acquiring equipment which are absolutely top of the line, and the expertise I have, which I have gained from AIIMS, going to put into this service, and maybe I'll do better subsequently also. The difference I see is not the equipments, not the setup. Different I see it how I'll approach my patients, because you would have not seen my OPD in AIIMS RP Center. If I'm sitting in the OPD, I have 200 patients crowding on me. But here I'll be seeing one patient at a time. I can give more time to that patient and get to an insight of a person, because it's not the disease which we are treating. We are treating the patient, the person. So first we can understand the patient better now. If I understand the patient better, he or she will understand me better also. It is a reciprocal thing, give and take. And the doctor is good. I can understand he can do good surgery. But you have to be very empathetic. You have to be a good human being, which I think, this is the best suited place where I can interact with my patient one-to-one, give time, get all the investigation done, and I can speak to that person in a manner, the question I can answer better also. I think that advantage I'll have in this area. And also, I have been administrator for so long.
You have mentored so many people.
So I think my clinical approach will be benefited in this area also. I'm pretty sure this private sector journey will be much better than what I had. And I can really do justice to the Dr. Agarwals group,
We have
providing
no doubt
good
about
care.
it.